Okay, perhaps before we wrap this up, let's touch base on something that's occurred over the last couple of years, COVID. And some of the patients that are coming in, we see patients that, reduce their oxygen levels, with the oximeter, and those measurements can drop significantly. And then you have the long COVID, people coming back, they have the brain fog and all that. So perhaps some cases that you've seen. Tom, could you start with that?
Yeah, that's the use of hyperbarics in the role. In fact, early oxygen delivery and the pre-hospitalization was something that the Italians saw in COVID as it progressed. And then as we took into hyperbarics and saw the role of hyperbarics in the acute care of COVID, what we were seeing is patients that were heading the wrong way. In 5 treatments, they were being released from the hospital. So the role of hyperbarics in that case, or those incidences, was incredible. And it's just the density of hyperbaric units out in the public. There are 6,500 hospitals in North America. 1,400 have hyperbaric chambers. So it's not standard of care, okay? We'd have to see a lot more density in order to get standard of care. Now, as far as long COVID, there's now long COVID's being divided into 2 sections, long COVID of the acute phase and long COVID of the chronic phase. Again, timing is important. Studies out of Britain are saying 10 treatments, and we can turn somebody around. In 2 weeks, we can turn them around and give them their lives back. And that's being seen, and that's kind of what we've seen in doing it. We're seeing up to 40% of our patients are long COVID. Mm-hmm. And they're coming to us because there's no other option.
And it's helping.
Yeah, it's helping.
Yeah.
Yeah.
So what is the number of treatments there that long COVID are required?
Again, timing. Acute long COVID is about 10 treatments. Mm-hmm. Chronic long COVID, now chronic, I'm talking now we're into year 3 of this. And they've had conditions that are, they have other things going on, like heart issues that are there. So you got to take those at case by case. Mm-hmm. But I would tell you that there are studies out there saying that 40 treatments, but that's something that I think is an automatic go-to. Well, why are we doing it? Because it's been done and it's shown to do this.
Are you piling on, in there as well, the vaccine injuries that some?
They are definitely a part of it.
Mm-hmm. And seeing help from that.
And the thing is, to document vaccine injuries right now is almost like the kiss of death to anybody that reaches out to challenge vaccines. I'm not an anti-vaxxer, I will tell you that. Now, is that an issue? No, I just look and read what's going on. We're downplaying the VIR system. In the current vaccine, with the number of reactions that we've seen with the current vaccine, previous vaccines would have been taken off the market.
Immediately.
Immediately, and it hasn't been done.
And it's a factor of like 1,000.
Yeah.
It's terrible.
Yeah.
How about you, Lena? What are you seeing?
I've seen quite a bit of long COVID. I just wanted to ask Tom a quick question. When you say the acute long COVID picture, I just want to make sure the audience knows that what you're talking about there is possibly after they're sick for 10 days, let's say, and then the several weeks after that, the residual symptoms that they're having.
Right. This
that's
isn't
what you're
months,
talking about.
Yeah, this is not months down the line.
Sure. And
okay.
So, I have gotten patients who are more into the longer COVID, months down the line, 3 months, 9 months, 2 years down the line. And I can say that they all improve. To this point in my practice, in this practice, they all improve. Now, does it take 10? Does it take 40? I've had a patient who's going to long COVID clinics. She was from Virginia, actually, and had to drive here, and said that, I've gone to all these places, no one can help me. They come here, it was 4 sessions for her. I mean, it blew me away because I actually called her and I said, "Where are you? Like, why haven't you been back?" She said, "Actually, Elena, I'm back to my baseline." And that was the quickest turnaround I've ever seen. So it actually shocked me. And then I've also had patients who I've treated for 40 sessions. Now, these patients have comorbidities, so they're having other factors that play into their illness. And so they also, however, go back to about 98% of their baseline. Now, sometimes they can have, depending on their lifestyle, their stress, they can sort of go have some deterioration in the effects. They come in for maybe 1 or 2 or 3 sessions and they're back to, their previous state. Now,
Kind of a tune-up.
yeah, tune-up, that's what I like to call it as well. So, yeah, I have the most common complaint that they come in with is fatigue, and followed by maybe shortness of breath and some dysautonomic, tachycardic, which, fast heart rate picture. Those are the most prevalent symptoms that present to me. And, we're talking about mitochondrial dysfunction at this point, neurocognitive immune dysregulation. So both of which hyperbarics addresses mitochondrial dysfunction. We give oxygen to the mitochondria starts to work, the body starts to feel energy, and they get their energy back. That's just a simplification, but yes.
It's the energy factory in our 100 trillion cells.
Yeah,
Yeah, so-
that's right. So we're talking,
Something important.
it's, and I want to say it's kind of easily fixed. The fatigue, and I've seen it over and over again. Until somebody comes in and disputes that, or I see that, then I'll keep saying, yeah, it really is very effective. I've seen it 100% of the time. It really is 100%.
One of the things in looking at long COVID too, over the last couple of years, what has been de-emphasized is traditional medicine. So you have cancers that have developed procedures that have been avoided in response to this COVID pandemic. So it's not an easy patient, and the role of the physician in doing and looking at these patients is imperative, because we are looking at very complex patients that present. So that's kind of what I wanted to say from our aspect. We're seeing complex patients that need medical management, and the role of the physician is imperative there, and the nurse practitioner.
Yeah, I hear you. I've had to treat patients with COVID, presenting COVID, but they're a very complex patient. They've had Lyme disease, they've had mast cell activation syndrome, they have EBV, Epstein-Barr virus. So we're not just talking the COVID picture here, and now we're dealing with this very complex picture that we have to treat them slowly. So there isn't just a cookie cutter protocol for this type of patient. So I'm just saying there is a simple way to address this. If you're coming in just with COVID, you're a healthy individual, you don't have a lot of medical history, and then you have the other patient who I just described that may take a little bit of, moving around, changing protocols, and so they both get a personalized treatment, basically, but we just have to work differently with somebody who comes in that latter case, somebody with lots of underlying conditions that have been sort of triggered as a result of this post-viral illness. All right.
I certainly appreciate both of you being here and such great information. We've covered the PTSD, talked about the heart, talked about neurological benefits of hyperbaric oxygen, cancer, and COVID, vaccine, injury, all this stuff. I think for anyone that has listened to this, understand the most important thing they can do is to look into the benefits of hyperbaric oxygen to treat whatever inflammatory issue they might be dealing with, where hypoxia is a factor. And I think, is it fair to say that we're all going to die of something that is either caused or facilitated, worsened with inflammatory condition? Is it fair to say that?
We're all going to die because of inflammatory conditions?
Well, it's something inflammatory is going to cause it, worsen it. It's a key factor there.
And
Yeah,
the
it's a
end
key
result
factor.
is we'll all die of hypoxia sooner or later.
Okay, and hypoxia leads to inflammation, so it's the root cause of the inflammation, right? Fair to say.
Sure. fair to
Okay,
say.
well, thank you for being here, Elena.
Yeah, it was
again.
fun. Thank you.
Tom, what a great pleasure, and I think we're gonna have another conversation here, but what we'll do is we'll post it, and hopefully you've enjoyed this and learned some things and know what to do. Thank you so much for
Thank
being
you,
here.
Ed.